my first research interest is research ethics. But and for a long time, I've been involved in a project which was concerned with ethical principles of so-called learning healthcare systems. So how new new information technologies change our approach to healthcare research, and especially what should be the right framework for digitalized and digitized medicine. And from this, I was also right now I'm also involved in a social science research, internet research projects, and I was quite surprised that there are some differences in ethical framework, and it depends from which side you are coming to internet research. So let's compare traditional healthcare research approach to data, and to data which is freely available on social networks, and the framework that is actually right now discussed and presented in different ethical guidelines for internet social research. So let's say in healthcare, the default option, of course, is consent. So wherever we involve participants or patients into research, we think that this is ethically proper to ask for their consent. Of course, there is right now the discussion that sometimes consent is impractical, because if you want to involve huge populations in many different sites, it's not really practical. Also, there are some kind of research which use only data, and they pose only a minimal risk to individuals. And sometimes we use the data which is already available and is de-identified, and there is no really need to ask for consent. So when we talk about learning healthcare systems, we are ethicists usually build a case that not in all cases consent is necessary. So they justified how we can somehow circumvent or abstain from this default option in healthcare research, and this default option is consent. And another idea that appeared in the context of learning healthcare systems and, let's say, broad concept embedded research, and this is actually the idea which was put forward by Tom Beauchamp, is that this overprotection which originated in the Belmont report led us to underprotection of patients. So what he said, he actually took this case of Dr. Pronovost, and Pronovost constructed a certain checklist for emergency room, and he wanted to prove that if all staff goes through this checklist, the rate of infections in emergency room is falling down. But and they right now they didn't take informed consent from the patients, and someone challenged it and questioned this fact that they didn't ask for informed consent, and the whole project was stopped. And Tom Beauchamp says, okay, this is a very small intervention which do not pose any risk to participants, and following the requirement of informed consent actually put patients on more risk that if you don't ask them for informed consent and just try to follow this checklist. So in that sense, sometimes a very harsh regulation, this overprotection of individuals can end up in a situation that you underprotect certain certain groups of patients. So that's why right now, when we discuss this change of ethical framework in learning healthcare systems, sometimes we resign from using the word participants. We talk about just the data subjects and the data itself. And actually, when you look at what is happening right now in internet social research ethics, actually the reverse situation, and because when people do research using, let's say, social networks like Twitter, they do not think that the default option is constant. The default option is lack of consent. So, but sometimes they think that the consent actually is justified. So they try to build arguments why consent should be justified, even if from a regulatory point of view, we don't even talk about research involving human subjects. And I think that we can say that there is this perception that in this kind of research in a web environment, people are rather underprotected. There is too less rules and regulations to protect subjects. And there is also this conception that actually data are people. So we are going from data to data subjects and to participants, and behind that behind the data there are subjects, and there are some risk involved with this kind of research. So when we talk about research, what kind of research we are talking about? So we are talking about collecting data from different social networks, especially from Twitter. And this can be of, for instance, public health research. So Sinenberg did a kind of systematic review to what kind of research are done with data which is retrieved from Twitter. And these are public health research like surveillance, network analysis, recruitment, engagement, and even some kind of public health interventions. And except medicine and public health, also different the disciplines use, of course, data from social networks like computer science, psychology, sociology, and economics. And there are also all these disciplines apply different methods, from content analysis to propagation patterns, sentiment analysis, and predictive correlations. Why social media? Why healthcare professionals or healthcare researchers really do use social media? And there are a few reasons. These reasons refers mainly to Twitter, also because, let's say, Twitter itself through its API allows to collect a lot of data, and terms of service of Twitter explicitly said that the data can be used for research. So that's why Twitter is such a great tool for all for researchers. And then in the literature, you can find at least 6 different reasons why healthcare researchers can use Twitter. It is very easy access to data. A single tweet has a lot of different data points. These data points are associated with the language, with the location, with, of course, the content, but also all demographic information which is associated with the profile, and or network connection with the profile, tweets, retweets, sentiments, and so on. So from one tweet, you can have a lot of metadata, which is really meaningful from a research point of view. And of course, another reason is this naturalistic setting. So for instance, you can see how people behave during a pandemic, what kind of information they say, what they say, where they are, how they behave. Another thing is this hashtag culture, which says, which means that people by themselves somehow tag information, and also it allows researchers to collect information about certain places, certain topics quite easily. And you can apply also search engines to collect this data. And there is also some additional reason which is not associated with the Twitter as a tool itself and the data that you can collect from Twitter, but it's just the fact that a lot of researchers in mainstream media use Twitter. So this is so researchers are just very much familiar with this tool. And right now, I would like to discuss with you at least one case, maybe the Facebook emotion contagion study. So please read the first case and think what could be potentially ethically important about this case. What are your thoughts about this case?
I think it's very interesting, the impact of the algorithms on everything that we've seen. So this case in particular, talking about filtering out the positive and having less engagement with the platforms, and negative emotion and that sort of thing. But I also think that we've seen that to be true. And I think Lucy alluded to this earlier, that algorithms sort of perpetuate and reinforce the opinions that you have and want to hear. So I think that there's some real power in the algorithms and how that has affected things, like you had earlier spoke of the compliance with vaccinations or masking and those sorts of things as well. I think that there is a whole lot of power in the manipulation of the algorithms.
So the first reason why this case would be, let's say, interesting for an ethicist is that actually this kind of intervention is not innocent. Yes, that this is actually a quite important intervention and manipulation into our everyday life. And you suggest that that the participants should be informed beforehand, that there should be some kind of informed consent.
I would agree with that. Yes, I think that this type of research should fall under the same sort of ethical requirements as any other type of research.
So you suggest that there is a let's say regulatory loophole, and the informed consent is not really legally required, but from ethical point of view, people should consent to this kind of intervention into their private life and how they behave in their social networks. Any other comment about this?
I was just thinking, I think the way that this sort of experiment does more than just, you know, I feel like if you're collecting and analyzing pre-existing data, pre-existing posts that people made freely on their own will, that they've given in sort of a public domain, I feel like in those sort of instances, consent is not as necessary. But here, when you're changing a variable and then you're testing individual results and you're affecting a person, I think that sort of control asserted over an individual, I think that is when consent becomes more ethically required, if that makes sense.
Okay, any other comments? Okay, if not, then I would like to say only two more things, because we don't have time. You are right in what you said. I just want to conclude with the fact, let's say, that there is right now there is a quite discrepancy, and online research are not even considered to be research involving human participants according to federal regulation, especially if you use data from Twitter. But as Nicholas Gold realizes, we should rather consider that data on Twitter and also on different social media are private data on public display. And that's why we should also respect how much people want to disclose, and that sometimes people would like also to be asked for consent if we are especially explicitly quote them or make reference to their identity. In a, let's say, in a European European context, let's say, according to Barbara Princek, individual identifiable data should be considered as inalienable individual possession, which is, possession is something different than property. So researchers can still make use of the data that they collect from internet, but at the same time, people have a say and they are entitled, for instance, to be forgotten. So if a researcher is contacted by its participants, participants can legally require to his data or her data be withdrawn, and that his or her person be forgotten, let's say, from the research project. So generally, what I wanted to say in this presentation is that the approach, there is a big difference how we approach medical data that originated in the medical healthcare system, and we justified this approach by public interest and population health, and the way how we approach data that is collected in social media research. These two ethical approaches are different, and we should be informed. We should inform ourselves and study proper ethical guidance. Okay, so that's all what I managed to say. Thank you very much.